And there we go. Good afternoon, everyone. Today is Wednesday, March 17th, 2:18 p.m., and welcome to Senate Education. Senators, I just want to start by thanking our bill presenters, Senator Hooker and Senator Chittenden, for a job well done. And I did and will continue to reserve, it doesn't look like we need it today, but time to consider amendments, etc., as we make our way through our work, most of which, or some of which, is still in appropriations. We know the waiting study, the literacy bill, and our recommendations in the fast track bill will all be coming out in the days ahead. So thanks everybody for that work. I also want to thank Senator Lyons, who I thought did an incredible job this morning overseeing the meetings on Kern-Hatton. We will continue to take testimony. Those of you who could not be there, please, I would recommend taking an opportunity to review that. I also have detailed notes from the last meeting when Emily Simmons was with us. I'm happy to, I will ask the Pro Tem's office to share those. And I believe the next step really will be the chairs of the three committees meeting again and really charting a path forward. Senator Lyons, is there anything that you want to add?
No, not really. It's just, there's so much there, and it's going to be, we're going to just have to focus, I think, on where our responsibilities lie. So our committee is going to have a short conversation tomorrow morning just to sort out where the committee would like to go. And then, as you said, I think the really important piece is for the three chairs to get together and plan a course of testimony and action.
Along those lines, I think I may have sent it before Senator Lyons arrived. If senators would please keep questions, start listing questions, create your own documents so that when we do come together, you have those questions and we can make sure that they are all answered. Any questions on that before we move on? Okay, seeing none. The good news is our work isn't, for the most part, in appropes and being worked on. The two main things before us this week, I would say, are H81 and continuing our work on S100, which is the Universal School Meals Bill. S100 I have forwarded to the report of the bill, Senator Pearson and Senator Starr, the chair of the committee. What I mean by forwarded the bill, what the draft amendment that I asked Mr. Dermeyer to compile, which we looked at yesterday. I wanted to start with both Senators Starr and Pearson to get a sense of their thoughts, some of which would be taken up in appropriations, but I suspect that we will return to S100 tomorrow. And then H81. H81 is, we also, now I feel like we have our calendar a bit cleared to return or continue to work on H81. And what I'd like to do today is we have two witnesses that we'll be hearing from. And then after that, I'd like to have a committee discussion around where senators are on the bill, their thoughts, who else they might need to hear from. I know that I also heard from School Board Association and I believe Principals Association that would like to also participate in additional conversations. Today, I just want to continue with these two witnesses. What I don't want to get into are sort of the back and forth sometimes can be a bit distracting. And so I want to focus on our witnesses that have yet to testify, and then we will continue with additional witnesses tomorrow. So with that, seeing, unless there are questions, I think we will go ahead. Jeannie, would you be so kind as to allow our witnesses into the room? Good afternoon to the two of you. Welcome to Senate Education. I just want to make sure I have your names correct. Julie, is it Filiberti?
Pronounced Filiberti.
Filiberti.
Mhm.
Filiberti. Ms. Filiberti, welcome. Great that you're here. And Suzanne, also. How do you pronounce your last name?
Dermeyer. Oh, I'm sorry. Dermeyer.
Dermeyer. Terrific, Ms. Dermeyer. Great.
I was reading and missed the cue.
No problem. Okay. Did one of you decide who would testify first?
Julie.
Okay. Terrific.
Yep, I'm gonna go
All right.
first.
Well, the floor is
Everybody-
yours on
okay, everybody-
881. Thank you.
Everybody hear me okay?
Yes, thank you.
All right, so I'd like to just thank the committee for allowing me to testify today. I work as a paraeducator at BFA Fairfax. It's a K-12 school up in the northwest corner of Vermont. And I'm here today to kind of represent the low-paid school employees. And the details of my story are different than other paraprofessionals, but yet the same, because a lot of the paraprofessional staff that works in schools are moms. And I am a mom, and that's how I kind of got involved in the school. I'm not going to go through a lot of my personal story. That is actually in the written testimony that I hope everybody got a chance to have. But I did want to say I have two girls. They're now in their 20s. They both attended the BFA Fairfax school system from kindergarten on through 12th grade. And when they were in elementary school is kind of when I became an employee and started working there myself. And I've been working there for the past 18 years. I started out part-time for 4 years. And then once my kids didn't want me volunteering in their classrooms anymore, I kind of moved on to a full school year position, but full days. And as an employee, I've been involved in numerous things, but one of the things that brings me here today is I have been a member of our Vermont NEA local, the FWEA, since we organized and became a group around 2011. So for the 10 years that we've been part of the organization, I've been involved in that. And I've been in a leadership role all of those years. I've been on the negotiating committee all of those years. And I was actually chief negotiator in the last 2 rounds of talks that we had. We just recently settled a 3-year contract for our support staff, and that will carry us through June of 2024. So that's where we are. So I wanted to talk a little bit about the statewide healthcare contract.
I'm sorry, could I interrupt? What did you say that, what contract will carry you through until 2024?
Our local school,
Okay.
our professional staff just settled our contract for our wages and our terms of agreement.
Okay, thank you.
So the healthcare statewide contract is something that we don't have our hands on anymore because it's negotiated at the state, and which is why we're here today. But the past contract that was negotiated just began in January of this year. So we are new to this contract. And a couple important things about the terms of that contract that I want to bring to light. We entered this contract paying the same percentage of premiums that we were paying before that contract. So in our case, the paraprofessional staff had negotiated a 90-10 split. So the support staff was paying 10% of the premiums and the school was covering 90%. That was different than what the teachers had negotiated in their contract. They were at an 80-20 split. So they were paying 20%, but we were able to pay 10%. So we came into the statewide contract at 10%. And another part of that contract was an adjustment. So in year 2, no employee would see more than a 2% increase. So that means beginning January next year, I won't be paying any more than 12%. So that's where I am. My financial story, I have been there for 18 years. I still make under $20 per hour. I'm making currently $18.25 per hour. That works out to about $21,000 per year. Those are my wages. I began taking the school plan when my husband retired. Our financial situation changed, and luckily, because of the Affordable Care Act, I was able to bring my girls with me and cover them till they were 26. That actually, for me, changes at the end of this month. My youngest had a birthday this week and turned 26. So beginning April 1st, I will be paying for a single plan. But for my comparison that I'm going to set up for you today, I want you to pretend that I have younger kids, and I would be paying a parent-child plan throughout this process. So that plan that I'm on is a high deductible Blue Cross Blue Shield plan, and the parent-child plan costs $13,500 per year. So this year I'm paying 10% of that, which comes to $1,350. Next year, because it can only go up 2% for me, and I'm paying 12%, it's going to be about a $270 increase for me in year 2. Now, if this bill doesn't go through and the technical changes can't happen, and we can't go to the table to negotiate different terms, I could be paying a minimum of 20% next year, because throughout the state, I think the average is usually around an 80-20 split. We don't know what that's going to be, but for me, that would be a significant increase, because in year 2, I would be going from 12% to what would be the third year or the first year on the next contract. That could be an increase of over $1,000 for me to go up to that percentage. So that's not considering any out-of-pocket costs. That's just the premium increase. And the hard part for me would be, because we have locally just negotiated a 3-year contract, I won't have a chance to put the wages into play to compensate for that. So that's definitely $1,000 that would be out of my pocket in that third year. We wouldn't be able to renegotiate until that next contract is up for us locally.
Julie, do you mind just telling the committee, what is it about H81 that prevents that from happening?
That prevents what?
Prevents the your healthcare costs potentially going up, where you'd be paying 20%.
Well, because it would give the chance to negotiate different terms for the lower paid employees. So that's not to say that once it's at the table, it might go up to 20%. We don't know, but we need to be able to get the chance to negotiate that. Okay?
I just wanted to make sure it was clear. Thank you. Please continue.
Okay. So I figure that means in year 3, about 13% of my salary would be going just to pay my healthcare premiums. Let's consider a lower paid employee, because I've been there for 18 years. What we've negotiated for wages, the lowest paid employee comes in around $13 per hour. That's only $15,000 per year. So that year 3, or that increase to them, is about 18% of their wages for the lowest paid. Now, not everybody's the lowest paid, so I did figure out what the average was at our district. That was about $15 per hour that people make, or $17,300 per year. So that's still a considerable amount. Let's contrast it with the teachers. So they're licensed individuals. Right now, they're paying 20% in premiums. they make $42,000 a year coming in. So that's double my salary right off the bat for a very new teacher at our school. That's 6% of their wages compared to anywhere between 15 and 18% for the support staff. And in addition to that, they're not going to see a big jump because they're already at an 80-20 split. So, that's comparable to them. They have to worry about the average healthcare costs going up because the percentage does seem to go up every year, but it's not going to be a huge jump for them. Consider an administrator. They can fall under their school employees. Some of them make six-figure salaries. To them, it's only a 2.5% or maybe even less amount of their wages would go towards healthcare premiums. So I think everybody here today realizes that somebody paying 2.5% of their wages versus somebody paying 18% of their wages, that's a pretty big discrepancy. The terms are going to be discussed, they're going to be hashed out at the table. That's not what we're asking you today. We want the opportunity to be able to get to the table and have those negotiations. I think you guys can agree that there's probably not a single working mother that can afford to pay 18% of her wages on her healthcare premiums. I mean, it's going to price things out of reach for a lot of the lowest paid employees. I want you guys to remember that this is a bargaining bill. This is not a healthcare bill. I mean, all of us are very aware that we have a problem with healthcare in the state, and we also have a problem with healthcare in this country. But this bill is not the time to hash out the healthcare. I mean, that's a lengthy discussion that needs to happen someplace else. We're just looking for a fix to the law that will allow us to negotiate. I mean, the School Board Association is looking for all these changes. We just need to get to the table, and we need to get there as quick as we can, because April 1st, the new round of talks are beginning, and we need a seat at that table to be able to discuss that. And I think the longer it goes out, the less chance we have of that. Proposals need to go in, and it's important that we know that that's can be on the table and can be something that can be talked about. We're not asking for anything new. This bill really allows us to have what we've had in the past. At the local level, we always had the ability to have healthcare on the table, and that's why the support staff had a 90-10 split versus the teacher having an 80-20 split, because we were lower paid and we were paying a smaller percentage of the premiums because of that. At the last statewide negotiation, we also had that ability to negotiate those costs for the differently paid workers. And that's why we entered in paying what we were currently paying under our locally negotiated contract. And we're asking for the same thing going forth, basically, is to have that ability to be at the table and negotiate that. I want you to remember that last year, S226, which was essentially this bill, passed this committee and it passed in the Senate. This is basically a rewrite of that. The circumstances for those lower paid workers haven't changed since then. And it's important that, that we can get those changes through so that we can negotiate these different terms. Time is of the essence here. I think it's really important that this can kind of get through this committee and onto where it needs to go, and hopefully can pass. So I'm available for any questions that you might have regarding this, but I just kind of wanted to paint a picture of what what it means for the people with the boots on the ground. And it's huge. For lower paid workers, it's a big chunk of money. So thank you.
Thank you. Committee, any questions? I think you did a very good job of painting, the boots on the ground.
Thanks.
Something that I think has been absent from this. Okay, Suzanne.
Thank you. I'll try to not take up too much of your time today either. So my name is Suzanne Dermeyer, and for years I was a Vermont elementary school teacher, and now I'm currently on staff at Vermont NEA. And what I'm here today to talk about, or the viewpoint I'm bringing to you, is that I have some real hands-on experience bargaining. Most relevant, I was a point person back in the days of Act 85 in 2017. That was the statewide commission that preceded the passage of Act 11. And more recently, I was an advisor to the Employee Commission members negotiating the statewide health insurance in 2019. So one of my main messages to you today is that H81 is clear, it's simple, it's a well thought out set of solutions to problems that were exposed by both parties during the first round of bargaining. And it upholds what we believe are core values of any collective bargaining process. That is to establish basic parameters for negotiations without favoring one side or the other. Any collective bargaining law, as in the case with this new statewide law, is enacted to facilitate basically a communication between the parties and not prescribe or dictate a specific outcome. And I also know that this is really about fairness. You just heard from Julie, and it's fairness for the essential public school frontline support staff. It's letting them have an equal place at the table in terms of bargaining healthcare. So in my long view of negotiations in Vermont, I have now passed 30 years on staff of Vermont NEA, and 9 years I was on a teacher negotiations team in the Mad River Valley where I taught grades 5 and 6. And I told you I was involved in statewide bargaining since the days of the commission in 2017. And that commission studied whether or not we should enact a statewide bargain. And that was a response to the School Boards Association's request to move to that statewide healthcare bargaining process. And that's, and I'll be honest with you, it's something Vermont NEA resisted. The Act 85 Commission offered a very extensive report. And within its report, it included a very strong statement, which is in my written testimony. I'm not going to read verbatim to you, but in essence, the commission said healthcare should be accessible, affordable, and equitable for all school employees, including and especially our lowest paid support staff. So as Julie also just said, H81 is fairly identical. It's not completely identical, but it's very close to what was passed in S226 last year in the Senate. It was fully vetted by the parties, and I'm sure Senator Perchlek will remember some of those discussions. And I'm going to say this again. It's what I said just a few minutes ago. It represents, again, a clear, simple, and well thought out set of solutions for the collective bargaining process. I testified last year in the Senate committee, and I was present most recently for most of the deliberations in the House General, as well as I testified there twice. I know as a committee, you've most recently heard from Joe McNeil representing the School Boards Association. And on the bottom of page 8 and 9 of the current bill as passed by the House, he was testifying to whether or not we should have the Vermont Labor Relations Board included as a step. And he believed in his testimony to you that we need it. What was written in the House bill contains somewhat of a technical error in that we should have a default process. I was in on the conversations with Chair Stevens of the House Committee, along with Mr. McNeil and Jeff Fannin, in which we came to agreement to insert the Labor Relations Board in some manner. And my takeaway from that conversation was the only change we were making to the proposed bill at that time was inserting the labor board as an option, not to create a default system in case we couldn't choose a single arbitrator or the labor board and then moving to the third party I'll start over again, moving to a 3-person panel. So as in the case with most of the teacher bargaining, and which has been going on for over 50 years, the parties are able pretty much to reach agreement fairly easily on who is going to represent them in dispute resolution. So I firmly believe that any change to the resolution process is not needed at this time. I'd also like to point out that the process of negotiating a statewide benefit during the first round went relatively smoothly for a new endeavor. We adapted to a pretty short timeline. Actual bargaining with exchange of proposals and debate are limited to 4 months, the months of April through July. And if we haven't reached full agreement by August 1st, we enter into the first phase, which is fact finding. We have, as Julie mentioned, we're pretty short on time. We only have 2 weeks before the parties are to meet for the first time. And we would like to know what the parameters of what we're bargaining are sooner than later. As example, not knowing what the scope of bargaining may be prior to the exchange of proposals could make the process a little more cumbersome and potentially lead to unnecessary delay. So I also believe, as Julie said, that we would love to have this moved out of this committee and approved by the full Senate and moved on as soon as possible. Before I conclude, I also want to state what we all know. Healthcare costs for Vermonters is not a sustainable cost. Collective bargaining is a process for school employers and school employees to discuss and decide who pays for what. That said, it is not a place to address our broken healthcare system and increasing costs for all Vermonters. The out-of-control healthcare costs that our citizens face must be addressed as a policy manner to ensure it impacts workers and employees as well. As you may know, it is for this reason that Vermont NEA has been a strong advocate for decades for systematic healthcare reform. Once again, I'm going to say these are simple technical fixes born from real experience, simple to understand and implement. And it is critical at this point we move forward with some speed and not endeavor to rewrite a new law, but rather focus on vetted, practical, simple, and timely technical fixes. I'd like to thank you for your time and consideration. I'd be happy to stick around and answer any questions you might have.
Thank you, Senator. Ms. Dermeyer, you were involved in the negotiations over the healthcare negotiations, and it seemed that the School Board Association was in favor of this time around. The idea, allowing the lower paid school staff to negotiate. What's changed?
Well, what's really changed was the original law, Act 11, allowed for in the first round of bargaining, in the first year of bargaining, that the premium and out-of-pocket amounts could be different for support staff as one big bucket versus professional staff. but that was not under Act 11 going to be in the second round of bargaining.
Okay, so in order for that to remain, we need to pass this bill.
That's correct.
To pass this bill. And have you seen any indication? I mean, I know that the concern is that if people, don't have to pay a lot for healthcare, if they have access to rather inexpensive insurance, that they're apt to utilize it more. I mean, have we seen that? Has there been enough time even to see the effect, or are things really going to change, or have they changed that much from when you were negotiating at a local level?
Well, first of all, I know there is a camp of people who believe that it's called induced utilization, that if you are afraid you're going to have to pay through the nose, you won't go to get medical services when you need them. However, I would tell you, we haven't gotten any data from that we can utilize right now based on what people have done in this most recent time. But we have no indication that over the years that there has been a run on healthcare from school employees. I think if you asked a lot of school employees, they're not looking for unnecessary care because, first of all, they've got to find a time they can make an appointment and get there. And their primary reason for visiting the doctor is so that they could be well enough to continue their job. They're not looking for other pieces. And if there is an argument about induced utilization and that's something that we believe should be at the bargaining table. And I'm sure if that's a belief of the School Boards Association, then we'll bring it forward.
Thank you.
Other questions for either Julie or Suzanne? Okay. Seeing none, thank you both very much for being with us. We appreciate it. And if we have any additional questions, we'll certainly be back in contact.
Is it okay if I stay and listen?
Sure, absolutely.
Okay, thanks.
Thank you.
You're welcome. Committee. Where are, I guess, folks at with regard to this bill? My thoughts are such that we'll hear, I know there are a few other people who'd like to weigh in tomorrow. I'm not sure if there are other people that you all would like to hear from before we move this down to appropriations. But looking to see if anybody, where everyone is at. Senator Perslick.
Yeah, I'm hopeful that we pass this bill out. I don't have anybody that I don't feel like I've heard from. Read a lot of letters from the school boards around the state. But I know a couple witnesses tomorrow seems like it would be well-rounded of the different perspectives. So I'm hoping after that we could have a vote.
Anyone else want to add to that? Senator Hooker.
I agree. I think we need to move it. It's, as Ms. Dermeyer said, we have 2 weeks before negotiation starts. It seems that this is the time to do it so that these people can have a place at the table.
Yeah. Senator Lyons.
I'll third that. No, I do think that this should move ahead. Without it, we put our staff at risk for paying more than they should have to pay. I think we allow for the negotiation process to go forward. And there is clearly a healthcare cost issue embedded in all of this. There's no question about it, but this isn't I agree that it would be great to take it up. That would be fun, but it would also take us a bit to sort through it all. So I think we we let our health and welfare committee, our finance committee, and others know that costs are an issue with people, but this is not that. This is a arbitration negotiation bill.
Right, this is bringing people to the table that aren't there. Senator Chinden.
Generally of the same mind. So I think there are fixes in here that the School Board Association definitely appreciated. I don't want to cast any aspersions, but it seems like the last arbitration lacked clarity. So it wasn't clear, it wasn't mandated that the arbiter to indicate where the decision came from. So I think they're appreciative of this new language, so at least they can understand what goes into the final result. And as for the additional language that the school boards, which I'm listening to and I've been processing, it's kept me up a couple of nights, where they want additional thresholds to address cost in the decision. I'm seeing what's in this Act 16, Act 11 as being consistent with what's already on the books for our other mandated languages for negotiation. So I think the language as is works for me, but I will say that the testimony by the Joint Fiscal Report gave me pause because there are real implications for this. So I'm very appreciative of that report. And as Senator Lyons just said, I think Senate Appropriations and other committees that this moves to next can keep that in mind. But from the negotiating perspective, this is fair and I support moving it out.
Okay. Anything else at this point? Okay, so my plan is tomorrow we will hear from a couple of additional individuals looking now for new information, and we'll also put on tomorrow for a committee discussion as well as a committee vote. Senator Terenzini, is there anything you want to add? I don't want.
No, not really at this time, Senator Campion. I just, I received, I'm assuming we all did, quite a few emails on this from both sides of the issue. So I'm going to do some more reading tonight and sort of do my homework, and because it has implications on both sides of the aisle. So it's one of those issues that's really pretty important to study up on. And so I look forward to hearing more testimony tomorrow.
Yep. Okay. I appreciate that and respect that. And I think we're all getting, still working on this and making certain that we understand our positions and what this bill will do and what it won't do. Okay. It does look like the only stop it will have after this is likely appropriations unless finance decides to take it in. Anything else? Okay, thank you both, Julie and Suzanne. And if Jeannie, you would take us off